Dr. Sudip Haldar, Head and Senior Consultant, Department of Surgical Oncology, Hope and Hill Cancer Hospital and Research Center.
Hello, I am Dr. Vishal Mukherjee, Consultant Surgical Oncologist, Hope and Hill Cancer Hospital.
As you all of know, October is a Breast Cancer Awareness Month. So we would like to introduce you the concept that was going on for the previous 50 to 20 years, that is a breast conservation surgery and sentinel lymph node biopsy. So initially it was like that we have to remove the entire breast to get rid of the breast cancer. But now different modification, chemosensitivity, true-cut biopsy and precision oncology, everything leads to de-escalation of the treatment, reducing the operative time, reducing the operative volume, and we can concentrate to remove the tumor along with some normal tissue, that is a wide local excision or lumpectomy, along with some axillary nodal dissection or sentinel lymph node biopsy. So this is terminology is called breast conservation surgery, and it is always mandatory to do the radiation after the surgery, so it is called breast conservation treatment. Now the terminology is oncoplasty. What is oncoplasty? It is the oncology is first, so we have to remove the tumor as oncological principle, followed by some plastic reconstruction, maybe from the on its own breast tissue or from the locoregional tissue or some free flap, whatever maybe it is required according to the defect. So that is oncoplasty. So oncology is the most important thing. We have to remove the entire tumor along with the normal tissue so that the margin will not be involved with the tumor. So that is the number one priority, and followed by a reconstruction so that the symmetry, so that the texture, it can be almost like to the opposite breast. So this is oncoplasty and breast conservation surgery.
Next, I will discuss regarding the sentinel lymph node biopsy. So what happens in carcinoma breast is that when there is a tumor in the breast, later proved through biopsy to be a cancer, it usually spreads to the adjacent axilla. And what it has been done over the years is that with the breast surgery also we need to do the complete axillary dissection, that is to remove the all soft tissues in the axilla. So what are the complications of this axillary surgery? So usually after breast surgery we have seen patients that patient presents with numbness of the upper part of the arm, sometimes with a large lymphedema of the ipsilateral side of the breast cancer. So now we are coming up with the sentinel lymph node biopsy. So what is sentinel lymph node biopsy? What we are doing in our hospital is that we are using the dual dye technique. That is, we are using the indocyanine green, that is the ICG, and also we are using the methylene blue. So what we do in case of a node negative disease, that is when the presents within breast cancer in an early stage, we do this sentinel lymph node biopsy and we identify the node which is present in the axilla. And while during the dissection of the axilla, we remove that part of the node only and send that node for the frozen section and analysis. So what the sentinel lymph node has helped us is that it has reduced the morbidity of the axillary surgery. The movements of the soldiers and the hand movements are even normal after surgery. So for the last 20 years, what we are moving is that we are moving from a very radical surgery to a very less surgery in case of a breast cancer. As in the primary also we are going towards the breast conservation surgery. Similarly in the axilla we are moving from a complete axillary dissection to a sentinel node surgery, and that sentinel node surgery can also be done even after giving neoadjuvant, that is giving chemotherapy first. We can even do sentinel lymph node biopsy. We are doing it for the last few years, and we are like on the verge of publishing our own data from the hospital.
The important thing is, be it a breast conservation surgery, be it a sentinel lymph node biopsy, so the de-escalation is not going to change the overall survival or disease-free survival. So technically speaking, the surgery is less, but the effect is the same as the previous surgery. So we can do the lot of less surgery, but the results are same. So definitely we'll definitely encourage those patients to undergo this type of surgery so that the complication and morbidity will be less. Thank you.
Thank you.